Assalamu alaikum guys. Here, here you can see learning objective. By the end of the session, you should know boundaries of the cubital fossa, contents of the cubital fossa, the relations which are present on the contents, and clinical aspects cubital fossa. Cubital fossa, which is present on your upper or forearm side. This is an area of the transition between the anatomical arm and the forearm. It is located as a depression on the anterior surface of the elbow joint. Here you can see, this one is the cubital fossa, and here's upper border which forms the biceps brachii muscle, basilic vein, pronator teres, which is present in below Zelic vein. It is median vein of forearm. Then this phallic vein, then medial cubital vein, which is present inside the cubital fossa. Boundaries of the cubital fossa. It is the laterally by the medial border of the brachioradialis muscle. Then medially, the boundary is laterally medial border of the brachialis muscle. Laterally by the medial border of the brachioradialis muscle. Medially by the pronator teres basement, which is formed from the imaginary line which join the epicondyles of the humerus. We should know better understanding with the epicondyles of the humerus, supraepicondyle and the infraepicondyle, medial and lateral apex, which is the meeting point of the medial and lateral borders. Brachioradialis overlaps the pronator teres. Here you can see this cubital fossa, which is intersects by the line between the lateral and the medial epicondyles, pronator teres, forearm flexors muscles, which are present inside brachioradialis muscle. Okay, here you can see, for your better understanding, I would like to introduce with you my handwriting written posterior compartment, radial nerve, basement, base, apex, medial boundary, lateral boundary. Okay, here you can see this cubital fossa, base which is formed upward, imaginary line, apex which is downward, medial border boundary which is formed from the pronator teres, as already asked, informed you guys, brachioradialis which form lateral boundary roof, superficial fascia which is medial cubital vein which attaching the cephalic and basilic vein and the medial and lateral cutaneous nerves of the forearm, the fascia of the superficial fascia, and contents mbbs. You can remember this contents of the cubital fossa from the mnemonic mbbs: median nerve, brachial artery, biceps tendon, superficial radial nerve. Here, so here you can guys visually understandable medial cutaneous nerve of the forearm, brachial artery which travels along the brachial vein, median vein, medial epicondyle, then it descends downward and towards the pronator teres, intersects, then passes the pronator teres and the cephalic vein पे आके terminate हो जाते हैं. Then contents, you are well aware from this. You can discuss from here. Clinically you can see this median cubital vein in this region, in this vein of the selection for the gathering blood samples. Most important objective, intravenous injections. For your giving intravenous injection, we will prefer the median cubital vein. Then brachial pulse and blood pressure to measure median cubital vein is very important. Content of the cubital fossa with notable brachial artery and the medial nerve and possible supracondylar fracture of the humerus. Blood pressure which is measured medial tendon, bicep tendon. Okay, venous puncture. Median cubital vein is located superficially within the roof of the cubital fossa. It connects the basilic and cephalic veins and can be assessed easily. This makes it a common site for venous puncture. Cubital tendon syndrome and Walkman contraction, which is most important. A CQ point of view, side determination and radius. For your further lecture, cubital tunnel syndrome and evokement contracture, which is the most important SAQ. Thank you so much. Allah Hafiz. Thank you. Shab Khair.